Hello, this is a very interesting case. This young man had two damaged central incisors, he had a gummy smile, and he had a frenectomy. And so in this case, I'm going to be internally bleaching the two central incisors following endodontics. I'm going to do periodontal crown lengthening surgery, which involves ostectomy and gingivectomy. I'm going to do a frenectomy, and I'm going to place veneers on the 4 anterior maxillary teeth. This entire case is in the library of dentistrymasterclasses.com. So click on the blue link in the description below and subscribe to dentistrymasterclasses.com. There's an organized library of all the Dental Minute videos, plus many complete comprehensive cases like this one. So these are just before and afters. So the 4 veneers following frenectomy, maxillary anterior crown lengthening extending from mesial of maxillary first molar to first molar right and left, and internal bleaching of the centrals following endodontics. See the endodontics here. So we're going to begin with the painless injection. You can watch this video. Now in this particular video, all I'm going to show you is how to perform a frenectomy. So we give the painless injection. I'm checking for attached gingiva. See, here's the unattached. There's the line between the keratinized attached gingiva and the non-keratinized unattached gingiva. Here's the frenum. This is the extent of the periodontal crown lengthening surgery. I'm marking the extent of it prior to surgery. Now I'm not going to show that in this video. That's going to be a forthcoming video located in the library of dentistrymasterclasses.com. In this video, I'm just going to perform a frenectomy. I'm going to show you how I was taught in my oral surgery fellowship years ago. These are curved hemostats. It's very important that you clip the frenectomy before you begin the surgery. If you just cut the frenum, you'll get lost. It'll expand, and the edges of the flap will move and you won't know where you are. So you always clip it like this first, and this tells you where to cut. Now you can see at the same time I'm beginning my maxillary periodontal crown lengthening surgery, which we're not going to show in this video. So then use a 15 barred Parker and just let it touch the curved hemostats. It never loses contact with the curved hemostats and meet right here. So I've gone this way, and it meets at the tips of those hemostats. The key to this is you've got to place the curved hemostats so you don't get lost. If you just cut this, the pieces move apart, the flaps move apart, and you lose your bearings. This keeps you perfectly in line. So this is the frenum. You've completely removed it. Then I'm going to suture that with 4-0 plain gut suture. Put 3 or 4 stitches in there. You won't be able to approximate the attached gingiva, just the unattached or the non-keratinized. Important when you're stitching that you take a deep bite, especially if you're stitching non-keratinized unattached gingiva. If you take just a little bitty bite, the suture will pull out. So take a big bite. And I'm going to place 3 or 4 of these suture. This is not chromic gut, this is just plain gut, and it will dissolve in 3 to 7 days. So here's my attached gingiva. You can't approximate that. That tissue won't move. Just the non-keratinized, non-attached gingiva is being stitched. Now, the reason there are stitches here is because I've also performed a periodontal crown lengthening surgery, both ostectomy and gingivectomy. We'll show that in forthcoming videos, and that will be in the library of dentistrymasterclasses.com. So here's the final photo of the frenectomy and the final photo of the maxillary crown lengthening procedure. Remember, crown lengthening is not just gingivectomy. It's both tissue, soft tissue removal and hard tissue bone removal. You have to recreate, so you recreate the proper biologic width. So this is after 6 weeks of healing. We've got provisional restorations on the maxillary incisors. Now the frenum has been removed. Now these are the final photos after I've completed everything, including endodontics, internal bleaching of the central incisors, periodontal crown lengthening surgery, frenectomy, and veneering the 4 maxillary incisors. This case will be in the library of dentistrymasterclasses.com in a few weeks if you want to see the whole case. These are just befores and afters. Ideal incisal plane. Talk about that. You always want the centrals to be the longest teeth, and you want this incisal plane to mirror the lower lip and the incisal plane of the centrals to mirror a line drawn between the pupils of the eye. Before and after. This entire case is in the library of dentistrymasterclasses.com. So click on the blue link in the description below and subscribe to dentistrymasterclasses.com. There's an organized library of all the Dental Minute videos, plus many, many complete comprehensive cases like this one. That's the Dental Minute. These techniques work, and they work every time.